Dr. John Brazier, the founder of Core Therapy. We're now going to look at the structure of the organs. We're still talking about structure because structure is fundamental to the processes of the body. Everything has a shape, everything has a structure, and that structure equates to the function of that particular part of the body. So if we have a change in structure, then we must get a change in the function. So if the chest is down, then we get a change in the lung capacity and the way the lungs clear themselves. So often we suffer from breathing difficulties like asthma, or we become sensitive to allergies, especially hay fever, stuff like that. And the lungs don't clear, so they can fill up with mucus, and we get problems in the whole breathing system. If you think about the kidneys and the shape of the kidneys, they have a function that's addressed by that shape. So if we get a change in the spinal curve in the back and it goes flat, then the pressure and the change of the shape of the kidneys will then affect its function. And so we often get increased urination and some energy challenges. So a couple of things I'm going to talk about quickly here is the liver. So the liver goes from the right hand side right across the chest here. It's a huge organ, very, very heavy, does lots of detoxification, especially at night when it swells up with blood, and it helps to purify the blood. But we know in Oriental medicine that the liver has a huge impact in other things, especially the eye quality, so your vision, so red eyes, dry eyes, headaches, migraines, pain in the body. We know if we use some liver acupuncture points that this helps to clear lots of pain in the body. Digestive processes, constipation, joint problems, all of these things can be affected by a liver that's not functioning correctly. So we need to ask ourselves, why is the liver not functioning correctly? So we'll go back to the pelvic stability and the pelvic position. If the pelvis is misaligned, then it will change the whole spinal alignment, and it will put pressure on the organ, so the organ becomes squashed. It's not open, it's not being stimulated by the diaphragm as you're breathing correctly. So another reason could be around the spinal area of T7, 8, 9, 10, so mid-spine, lower mid-spine down here. If there's a fixation, a blockage, then every time you move and turn and bend and talk to people and show your emotions when you're talking, then there's no stimulus to the liver. There's no pressure and pushing on the valves and the blood flow and everything to help the processes work in the body. So we get the dysfunction of the liver, and then that leads to all of these different symptoms that everyone suffers. So when somebody comes into our practice, we ask them a lot of questions about what it is you're suffering, how long have you been suffering, what's it feel like, and then we go through a process of diagnostic evaluation to see what movement, what's working and what's not working in the muscles. Another obvious one is the reproductive organs. If you imagine the size of the fallopian tubes in a lady's reproductive system coming down from the ovaries, so they're very, very tiny, and the egg has to travel down this tiny tube. And then if you just take the pelvis and you twist it one way, tilt it or rotate it, then how do you think that's going to affect the tissue that then affects the pressure onto this tube, and whether this person can be fertile or whether they're infertile? And all of these things affect everything that's going on in your body. So a hotel that I work at, we've had 8 new babies. We call them core babies, because these were with couples that couldn't have produced a baby over the last 4 years. Straighten the pelvis, straighten the spine out, and all of a sudden, surprise, surprise, they're pregnant within 6 or 8 weeks. So, it's not huge research, but it's clear that by keeping the structure, keeping the organs in their shape, in their designed alignment, then you get potency and power.